Hello, my name is Gwyneth Lyman, and this is my study on access to veterinary care for low-income populations. Animal companions are essential for the emotional, physical, and social benefits of a wide range of different people. Pets provide humans with a non-judgmental companion, and in return, humans provide for and nurture their animals. However, care for a companion animal can be nearly unattainable without a comfortable income. In low-income populations, accessible veterinary care that is affordable can be lacking. There needs to be support systems in place that address the welfare of low-income humans and their animals. Through qualitative analysis of interviews with veterinarians, I examine existing systems that provide support for impoverished pet owners to determine the best practices to better serve low-income populations. In the United States, 57% of households and 25% of the homeless population have some sort of companion animal. This is a huge percentage of our population that's caring for their animals day in and day out and providing them with food, shelter, and other services. But a lot of people don't think about what they provide back to us. Pets have been proven to provide social, emotional, physical, and mental benefits to their human owners. For example, many dog owners are more physically active when they have their pet because they have to take their dog on long walks to care for their animal. And this is not a lone circumstance. Pets provide a lot of benefits for us. In fact, many people, when interviewed, said that their companion was a part of their family or a close friend, giving them a great sense of companionship that they would otherwise be lacking. However, it is not always simple to be a pet owner, as access to veterinary care can be very costly, and low-income pet owners are much less likely to utilize a vet clinic. Even while specific programs have helped make vet care more accessible, there are still boundaries due to financial struggles, cultural barriers, and ultra-specified programs that prevent a lot of owners from reaching the benefits they need to care for their pet. As I have touched upon, there are organizations that offer veterinary help for low-income families. However, many of these organizations have complex application processes or are widely only available through online access, which makes it harder for families that don't have the same internet availability to access these sites and get the help they need for their pets. This is also done on a strictly case-by-case basis, which means many people are left on the wayside simply because a certain individual or an organization decided that they were not as in need as others for that help. The situation is even further complicated by different cultural barriers or language barriers that make it hard for an individual to connect with an organization or a veterinarian that may be providing for their animal. The exclusion of unlicensed animals and animals lacking a full history of vaccinations also leaves many people out, as licensing an animal can be very financially difficult, and vaccinations are hard to get. While there are pop-up clinics that provide these opportunities, they often only happen once a month or once every few months, and they're very limited in what they can provide, usually only giving 1 or 2 vaccinations in total at that time. I conducted an interview with a veterinarian working in the northeastern corner of the United States who works in a more urban setting and found that there is limited access to veterinary care. Usually, the only care provided was seen at the clinical level alone. This vet stressed the importance of animal companions as they provide people with happiness and improved quality of life and a strong relational bond that they might otherwise be lacking. During once-a-month pop-up clinics that this veterinarian holds to provide free or reduced veterinary care to families, they found that many people were coming in who would not normally come into their clinic on every other day due to financial disadvantages and cultural, racial, transportation, and language barriers that each played a role in preventing many people from accessing the same care. They stressed that changes need to be made at the clinic, organization, and national level to make a difference for many of these families. At the clinic and organizational levels, this care needs to be more routine and offered more often so that more people can access it. It also needs to be more clear so that people understand exactly what their animal needs and what they're getting from it, which would make many people more willing to seek out veterinary care in the first place. At a national level, there also needs to be immense change. Part of this does need to be more financial opportunity, but a lot of it also needs to cover the animal-human bond and how this care is not just an advantage to the animals receiving the veterinary care, but also to their human owners. The business model of veterinary care that we have now leaves many people out, and that is not the answer we need for the well-being of animals and for the well-being of their human owners, who get an immense amount of benefits from having that companionship. When discussing this topic with the veterinarian, I found that she and her colleagues fell into two main schools of thought surrounding this topic. While a lot of veterinarians agreed with her that animal companions are an important resource for low-income populations to have access to, many others thought that owners should only be permitted to have a pet once they are financially able to provide for every situation, meaning that for the well-being of the animal, they should only get that animal once they have enough food for all of the resources like food, shelter, and every veterinary situation that might arise. Both of these stances are very important, as one is really looking at the human welfare in the situation and understanding what the human needs might be, while the other is really taking into account the animal welfare and what they might need to benefit and to live a happy, healthy life. However, if actions were taken to make vet care more affordable, low-income populations would be better able to take care of their companion animal and be more financially enabled to provide these things. This would be beneficial for both sides, as it would provide humans with the ability to own pets, but it would also make it more secure on the veterinary side for the animals, so they would have more access to the care that they need if presented with a very difficult scenario. I have found that the care and safety of the animal is essential when introducing any pet into a family or a home. The well-being of the animal must be a priority when setting these standards. I've also found that low-income families should be able to have the wide array of proven benefits having an animal companion can provide. This can be anything from an improved creation of routines to being instrumental in the improvement of the quality of life of many people. Making changes at each level of veterinary care, through each clinic, organization, and even at the national level, is the greatest way to implement positive change that will be effective for low-income communities and their animal companions. We need to take this bond seriously and understand how positive changes at the veterinary level can affect people and animals across the nation. This is too an essential bond to be provided to only those at the top of the financial ladder. Thank you.